Hello, everyone, and welcome to Health Secrets, your trusted source for scientifically backed and holistic health insights. Today, we'll be diving into a common yet often overlooked health issue: low blood pressure. This isn't just a number on a blood pressure monitor. It's a condition that can directly impact a person's quality of life. Low blood pressure, or hypotension, occurs when blood pressure drops below 90-60 mmHg, reducing the flow of blood to vital organs such as the brain, heart, and kidneys. This can lead to symptoms like dizziness, fatigue, nausea, and even fainting. Many people mistakenly believe that only high blood pressure is dangerous, but in reality, low blood pressure can also pose serious risks, especially if it persists over time or occurs suddenly. However, not everyone with low blood pressure needs to be concerned. In some cases, it may simply be a normal physiological state for that individual. The key questions are: when does low blood pressure become a problem? What warning signs indicate that the body is in danger? And most importantly, what can we do to improve this safely and effectively? In today's video, we'll explore the common symptoms of low blood pressure, helping you identify them early and distinguish them from other health concerns. The causes of low blood pressure, including underlying medical conditions, lifestyle habits, and environmental factors. Effective treatment methods ranging from modern medicine to valuable traditional remedies that naturally help balance blood pressure. Additionally, we'll share massage and acupressure techniques, dietary recommendations, and herbal remedies that can support long-term blood pressure stability. Warning signs your body may be at risk. Low blood pressure is not just a minor number on a monitor. It is a warning signal that the body is not receiving enough blood and oxygen to function properly. Many of us may have experienced dizziness upon standing up suddenly, unexplained fatigue, or even fainting. Yet we often ignore these symptoms. These could be early signs of low blood pressure that the body is trying to communicate. So, what are the symptoms of low blood pressure, and which warning signs should we pay close attention to? Dizziness and lightheadedness, the most common symptom of low blood pressure. One of the most frequently reported symptoms of low blood pressure is dizziness or lightheadedness, especially when transitioning from a sitting or lying position to standing. This condition is also known as orthostatic hypotension. When this happens, you may feel off balance, experience blurred vision, or even feel like the ground is shifting beneath you. This occurs because the body hasn't yet adjusted blood pressure quickly enough to supply adequate oxygen to the brain when changing positions. If this only happens occasionally, it may not be a cause for concern. However, if dizziness is frequent, especially when accompanied by disorientation or confusion, it could indicate an underlying health issue that requires attention. 2. Fainting. A serious warning when blood pressure drops too low. Fainting, or temporary loss of consciousness, is one of the most alarming symptoms of low blood pressure. This happens when the brain doesn't receive enough oxygen due to decreased blood flow. This situation is particularly dangerous if it occurs while driving, climbing stairs, or engaging in activities that require full concentration. If someone around you suddenly faints, lay them down, elevate their legs to help blood flow return to the heart and brain, and seek medical assistance if necessary. Just 3. Blurred vision and lack of concentration when the brain doesn't get enough oxygen. Our eyesight depends heavily on an adequate oxygen supply from the bloodstream. When blood pressure drops, the eyes may be affected, causing blurred vision, difficulty focusing, or a sensation of looking through a foggy lens. Many people mistake this for eye strain from excessive screen time or stress, but in reality, it could be a sign of an underlying issue related to blood pressure. If you frequently experience difficulty concentrating, memory lapses, or a foggy feeling without a clear reason, check your blood pressure. Low blood pressure could be affecting your brain's ability to function optimally. Persistent fatigue, when the body lacks the energy to function. One of the most significant effects of low blood pressure is persistent fatigue, lack of energy, and reduced motivation to perform daily activities. When blood pressure is low, the body struggles to pump enough blood and oxygen to tissues, particularly the muscles and brain, leading to exhaustion even when little effort is exerted. This symptom is often overlooked because people assume that fatigue is due to lack of sleep or work-related stress. However, if you are getting enough rest and maintaining a balanced diet but still feel lethargic and weak, it is time to check your blood pressure. Nausea and digestive issues. When low blood pressure affects the digestive system. Few people associate low blood pressure with digestive problems, but in reality, it can cause nausea, bloating, indigestion, and even diarrhea. This occurs because blood is not adequately distributed to the stomach and intestines, slowing down digestion and nutrient absorption. A specific type of low blood pressure, known as postprandial hypotension, commonly affects the elderly. After eating, the body directs a significant amount of blood to the digestive system to aid nutrient absorption. However, if the blood vessels do not adjust quickly enough, blood pressure can drop significantly, leading to dizziness, nausea, and fatigue after meals. 6. Pale, cold, and clammy skin, when blood circulation is insufficient. Prolonged low blood pressure can make the skin pale, cold, and clammy, especially in the hands and feet. This is a sign of poor circulation, indicating that the body cannot maintain a stable temperature. In traditional medicine, this condition is often described as a deficiency in vital energy and blood flow, leading to internal coldness. Remedies such as acupressure massage, soaking the feet in warm ginger water, or consuming herbal teas like cinnamon, ginger, and ginseng can help improve circulation and keep the body warm. 7. Rapid heartbeat and shortness of breath, when the body tries to compensate for oxygen deficiency. A natural response of the body to low blood pressure is an increased heart rate as it tries to pump blood more quickly to vital organs. This can cause a sensation of a racing heart, rapid breathing, or shortness of breath, even without physical exertion. If you frequently experience heart palpitations or an unusually fast heartbeat without an obvious cause, it could be a sign that your blood pressure is too low and that your heart is working overtime to compensate for the lack of blood flow. Placer far? Understanding the risks of low blood pressure. Low blood pressure is not always dangerous, but if you frequently experience symptoms such as dizziness, fatigue, blurred vision, nausea, fainting, or an abnormally fast heartbeat, it may indicate that your body is not receiving enough blood and oxygen to function properly. If this condition persists or interferes with your daily life, you should monitor your blood pressure regularly, adjust your lifestyle, and seek professional medical advice. Causes of low blood pressure. What causes blood pressure to drop? Low blood pressure is not a specific disease, but a manifestation of a disorder in the circulatory system or an imbalance in the body. Some people may have naturally low blood pressure without any symptoms, while others may experience severe symptoms due to a sudden or prolonged drop in blood pressure. So what causes blood pressure to drop? To answer this question, we need to delve into specific causes, from normal physiological factors to underlying health conditions. Identifying the cause will help you find the appropriate solution rather than just focusing on treating symptoms without addressing the root cause. Dehydration is one of the most common causes of low blood pressure. When the body loses water, blood flow decreases, causing blood pressure to drop. There are many causes of dehydration, such as not drinking enough water, sweating excessively during intense exercise, working in hot environments, or suffering from fever, diarrhea, and vomiting, which cause the body to lose water rapidly, and also important minerals like sodium and potassium. In severe cases, blood loss due to injury, surgery, or internal bleeding can reduce blood volume, leading to a sudden drop in blood pressure. The solution is to ensure adequate hydration every day, especially when exercising or in hot weather. Drink electrolyte water if experiencing diarrhea, vomiting, or excessive sweating to maintain mineral balance, and monitor blood pressure regularly if there is a history of low blood pressure due to dehydration. Anemia is a potential but important cause of low blood pressure. When the body does not have enough red blood cells or hemoglobin to carry oxygen, the heart has to work harder to pump blood, but blood pressure may still drop. Causes of anemia include iron deficiency due to poor diet or prolonged blood loss, vitamin B12 or folate deficiency, causing disorders in red blood cell production, chronic diseases like kidney failure or cancer, hindering red blood cell production. Signs include pale, yellowish skin, prolonged fatigue, shortness of breath, rapid heartbeat, dizziness, and fainting. The solution is to consume iron-rich foods like red meat, liver, spinach, lentils, use vitamin B12 and folate if necessary, especially for vegetarians, and have regular checkups to test blood counts, especially if symptoms persist. Low blood pressure can be related to cardiovascular problems, especially if you have underlying heart disease. When the heart is unable to pump enough blood, blood pressure will drop, leading to a lack of oxygen in important organs like the brain and kidneys. Cardiovascular diseases that can cause low blood pressure include a slow heart rate, which reduces the amount of blood pumped, heart failure, where the heart cannot pump blood effectively, causing chronic low blood pressure, and heart valve insufficiency, where the valve does not close properly, causing blood to flow backward, which reduces blood flow to the body. The solution is to have regular cardiovascular checkups if there is a family history of heart disease. Maintain a healthy diet low in salt and cholesterol to support heart health, and engage in light exercise such as walking or yoga to improve heart health. The endocrine system plays an important role in regulating blood pressure. If there is a hormone imbalance in the body, blood pressure can be affected. Endocrine diseases that cause low blood pressure include hypothyroidism, where the thyroid is underactive, slowing the heart rate and potentially lowering blood pressure, adrenal insufficiency, where the adrenal glands do not produce enough cortisol and aldosterone, leading to sodium and potassium imbalances and causing low blood pressure, and diabetes, which affects the autonomic nervous system and can disrupt blood pressure regulation. The solution is to check thyroid and adrenal function if any abnormal symptoms appear, maintain a balanced diet, avoid processed foods, and take medications as prescribed by a doctor if there are endocrine disorders. Some medications can lower blood pressure, such as those used to treat high blood pressure, diuretics that cause dehydration and electrolyte imbalances, antidepressants and sedatives, and vasodilators. If you have low blood pressure and are taking these medications, discuss with your doctor to adjust the dosage appropriately. Treatment solutions for low blood pressure, combining modern medicine and traditional remedies. Low blood pressure can cause many discomforting symptoms affecting overall health and quality of life. However, it is important to note that not everyone with low blood pressure needs immediate medication. In fact, combining treatment methods from modern medicine and traditional remedies can help stabilize blood pressure naturally, safely, and effectively over the long term. So how can low blood pressure be managed? Let's analyze various treatment approaches, from lifestyle changes and dietary adjustments to complementary therapies, helping you take a holistic approach to your health. 1. Lifestyle changes, the key to naturally stabilizing blood pressure. Low blood pressure is often linked to inadequate lifestyle habits, so making the right lifestyle adjustments is one of the most important solutions for controlling this condition. Drinking enough water each day is essential. When the body is not supplied with sufficient water, blood volume decreases, leading to a drop in blood pressure. Drinking at least 2 to 2.5 liters of water daily, especially in the morning, helps stabilize blood pressure. If you frequently feel dizzy when standing up, try drinking a glass of water before changing positions. Increasing salt intake in a controlled manner can also help. Salt helps retain water in the body, maintain blood volume, and improve blood pressure. However, it should not be overused, particularly for individuals with heart or kidney disease. A moderate amount, around 5 to 6 grams of salt per day, can help stabilize blood pressure without posing health risks. Eating smaller, more frequent meals is especially beneficial for individuals experiencing postprandial hypotension, low blood pressure after eating. When consuming large meals, a significant amount of blood is directed to the digestive system, causing blood pressure to drop sharply. Dividing meals into smaller portions helps facilitate digestion and prevent sudden drops in blood pressure. Avoiding sudden movements is crucial. If you frequently experience dizziness when changing positions, move slowly, sit for a moment before standing up, and allow your body time to adjust. Engaging in light exercise such as yoga, walking, or swimming can improve circulation, enhance cardiovascular function, and help maintain stable blood pressure. However, overexertion should be avoided as it may cause sudden blood pressure drops. How to? A well-balanced diet. Foods that help stabilize blood pressure. Nutrition plays a crucial role in controlling low blood pressure. Certain foods can help raise blood pressure naturally, eliminating the need for medication. Iron-rich foods, vitamin B12, and folate are essential, especially for individuals experiencing low blood pressure due to anemia. Foods such as beef liver, red meat, eggs, dairy, spinach, lentils, and whole grains help supplement iron levels, stimulate red blood cell production, and improve blood circulation. Protein-rich foods such as salmon, chicken breast, and soybeans can help strengthen heart health and maintain stable blood pressure. Protein also plays a crucial role in maintaining blood circulation balance and supporting kidney function. Natural juices, such as orange juice, carrot juice, and coconut water, provide essential vitamins and minerals, improving circulation and preventing hypotension episodes. Ginger tea, cinnamon tea, and ginseng tea, commonly used in traditional medicine, serve as natural remedies for low blood pressure. Ginger stimulates circulation, cinnamon helps keep the body warm, and ginseng enhances overall well-being, contributing to stable blood pressure levels. H3. Acupressure massage, a traditional medicine approach to stabilizing blood pressure. Traditional medicine suggests that low blood pressure is linked to a deficiency in vital energy, qi, and an imbalance of yin and yang within the body. Certain pressure points, when massaged correctly, can help stimulate blood circulation, enhance energy levels, and stabilize blood pressure. Yongquan Point, Kidney 1, located on the sole of the foot, can be gently massaged by hand or soaked in warm water to enhance circulation and reduce dizziness caused by low blood pressure. Hegu Point, Large Intestine 4, located between the thumb and index finger, can help relieve stress, improve blood flow, and support blood pressure regulation. Taiyang Point, found on both sides of the temples, can be gently massaged to reduce nervous tension, improve blood circulation to the brain, and effectively alleviate dizziness and headaches associated with low blood pressure. 4. Medical treatment. When is medication necessary? In some cases, if low blood pressure significantly affects health and does not improve with lifestyle modifications, a doctor may prescribe medications to help regulate blood pressure. Fludrocortisone helps the body retain water and salt, increasing blood volume to improve blood pressure. Midodrine stimulates blood vessel constriction, helping to raise blood pressure in individuals with chronic hypotension. However, medication use must be supervised by a doctor, as improper use may lead to excessively high blood pressure, headaches, or cardiovascular complications. It is essential to avoid self-medicating and always follow professional medical advice. Preventing low blood pressure, how to maintain stable blood pressure long-term. Low blood pressure not only causes discomforting symptoms, but can also affect overall health if not properly managed. However, the key is not just to treat it when symptoms appear, but to implement preventive measures to maintain long-term blood pressure stability. Preventing low blood pressure is not complicated, but it requires commitment to a healthy lifestyle, a proper diet, and effective stress management. So, how can you prevent low blood pressure from recurring and keep your body in optimal health? Nutrition management, eating right to stabilize blood pressure. Nutrition is a crucial factor in maintaining cardiovascular health and blood pressure balance. Choosing the right foods can help maintain stable blood pressure and prevent hypotensive episodes. Consuming iron-rich and protein-rich foods helps boost red blood cell production and ensures adequate oxygen transport throughout the body. Foods such as red meat, organ meats, liver, eggs, salmon, seafood, soybeans, and chia seeds are highly nutritious and can significantly enhance blood circulation. Increasing intake of naturally salty foods such as sea salt, seaweed, coconut water, and bone broth helps maintain electrolyte balance in the body. However, salt intake should be controlled to avoid negative effects on the kidneys and cardiovascular system. Eating plenty of leafy greens and fruits rich in vitamin C, B12, and folate supports the nervous system and enhances blood circulation. Vegetables such as spinach, broccoli, carrots, oranges, grapefruits, and guavas help combat fatigue and maintain stable blood pressure. Limiting caffeine and alcohol is essential, as although caffeine can temporarily raise blood pressure, Excessive or frequent consumption may lead to irregular heart rhythms and interfere with the body's natural blood pressure regulation mechanisms. Maintaining a healthy lifestyle, the key to stable blood pressure. Lifestyle plays a significant role in managing low blood pressure. Certain daily habits can help maintain stable blood pressure and reduce discomforting symptoms. Drinking enough water daily, especially mineral water with electrolytes, helps prevent dehydration and maintain adequate blood volume. Avoid standing up too quickly to prevent dizziness and imbalance caused by orthostatic hypotension. If you frequently experience dizziness, sit for a moment before getting up. Engage in regular physical activity with gentle exercises such as yoga, walking, and swimming to stimulate blood circulation and strengthen cardiovascular health. However, avoid intense workouts or sudden position changes, as they may cause a rapid drop in blood pressure. Maintain a calm and relaxed mindset by practicing meditation, deep breathing, reading, or engaging in healthy recreational activities. Chronic stress can negatively impact the nervous system and contribute to blood pressure imbalances. Traditional medicine methods to stabilize blood pressure. In addition to modern treatments, traditional medicine offers various natural methods to improve and maintain stable blood pressure. Acupressure and massage are effective techniques for stimulating blood circulation, enhancing blood flow, and reducing symptoms like dizziness and fatigue. Some important acupressure points for managing low blood pressure include Yongquan Point, Kidney 1, located on the sole of the foot, helps enhance energy flow and circulation. Soaking the feet in warm ginger water and massaging this point can help alleviate cold hands and feet, as well as fatigue. Hegu Point, large intestine 4, found between the thumb and index finger, helps regulate qi, vital energy, reduce stress, and support blood pressure balance. Baihui Point, governing vessel 20, located on the top of the head, aids in improving blood flow to the brain, relieving dizziness, and easing headaches associated with low blood pressure. Using natural herbs such as ginger tea, cinnamon tea, ginseng, and licorice root helps boost energy and support blood pressure stability. Ginger tea is particularly beneficial for sudden drops in blood pressure as it quickly stimulates circulation. Soaking the feet in warm ginger or salt water at night helps warm the body, promote circulation, and contribute to long-term blood pressure stability. 4. Regular health checkups, preventing underlying risks. Low blood pressure may be a warning sign of an underlying health condition, so regular medical checkups are essential for early detection and timely intervention. If you frequently experience symptoms such as dizziness, prolonged fatigue, rapid or irregular heartbeat, or unexplained fainting, visit a healthcare facility for blood pressure monitoring and necessary tests, including blood tests, heart ultrasound, and thyroid function evaluations. If you are taking blood pressure medications or any drugs that may affect blood pressure, consult your doctor for adjustments to prevent dangerously low blood pressure levels. Understanding low blood pressure, a balanced approach to health. After thoroughly exploring low blood pressure, from symptoms and causes to treatment and prevention strategies, we can draw a valuable lesson. The human body is a complex system of balance, and any disruption can affect overall health. Low blood pressure is not just a number on a monitor. It reflects blood circulation, cardiovascular health, nervous system function, and daily lifestyle choices. The key is not to worry excessively about low blood pressure, but to understand your own body. When is low blood pressure a normal physiological state, and when does it become a concern? When can lifestyle adjustments help, and when is medical intervention necessary? These are questions that everyone should consider and explore in order to protect and maintain their long-term health. Stable blood pressure, healthy life. Good health is not just about avoiding illness. It is about living a life full of energy, mental clarity, and freedom from health limitations. A truly healthy body allows us to work efficiently, enjoy life's pleasures, and stay free from fatigue, dizziness, or weakness caused by low blood pressure. That is why it is essential to nurture your body in the best possible way through a well-balanced diet, a healthy lifestyle, and safe, natural treatment methods. If you found this content valuable, don't forget to hit the subscribe button on Health Secrets to ensure you never miss important health insights. Every subscription, share, and interaction from you is a tremendous motivation for us to continue providing useful knowledge, helping everyone lead a healthier and more vibrant life. Share this video with your friends and family because they too might be dealing with low blood pressure without knowing how to manage it correctly. Thank you for watching, and see you in the next video on Health Secrets.